Now that we've gone through the identification of the problem, the second part of using this product is going to be the proper application of the wedge on your shoe liner, your insole, or your sandal. The wedge comes in 3 sizes, which will be dictated by the shoe size of your patient. So it's a small, medium, and large wedge, and basically the wedge is going underneath the big toe. Okay, the application, we're going to have our patient standing on the insole. We want to make sure that her heel is in the proper position, so all the way back in the heel. And then we're simply going to mark the end of the big toe right on top of the insole. Okay, you can go ahead and step off. And the wedge, in this case, is a small wedge. We're going to peel the backing off the wedge, and this is going to go on the bottom of the insole. And the end of the wedge is going to be right at that line that we marked on the big toe. And this is going to be positioned so that this straight part of the wedge is roughly perpendicular to the long axis of the foot. So it just goes on like that. We're just verifying that the wedge is underneath the big toe. Okay, you can go ahead and step off. We'll have her walk, and if this is uncomfortable, this can be repositioned. In most cases, this can come off the liner and can be repositioned if necessary. If she has a bunion, we would want to position the wedge more in this direction so that the wedge is actually underneath the big toe. So the bottom line is we want the wedge always to go underneath the big toe. And that's all there is to it. This process should be very quick. This should take you no more than a minute to apply this to a set of insoles.